So we're here to talk a bit more about the concept of multisensory integration. So what we're actually going to attempt to do is go into research that I've had the opportunity to look over, to take what is in that research and apply it somewhat clinically. Understanding that the manner in which I'm going to do this is a hypothesis generated from the findings of the research. What we want to discuss briefly before that is that when you're looking at scientific research, we can, if we have an analogy or a visual, that this is the frame of a question. Right? So when we frame a question in this fashion, we collect the data and there's only an answer that lives within this frame. Now if we do this to the frame, if we slightly change the frame, so we've changed the question mildly, the data that we collect will end up being somewhat different. Right? So what is true in this frame is slightly different than in this frame. So we want to understand that. So when I look at research and attempt to pull it out as far as phenomena that have been demonstrated in a research setting or in a laboratory setting and put it into a clinical situation, sometimes it's not completely congruent. Sometimes there are some challenges. So the things that we state as a result of the research may not be perfectly accurate in a clinical situation, but we can take information from it and extend it slightly, or at least attempt to. Now, what I want to talk about here is the concept of top-down processing. So somebody very smart in my past introduced me to the concept of bottom-up processing versus top-down processing. So bottom-up processing is something where the sensory information goes to the brain, right? So we're responding to that sensory information. In osteopathy, we essentially call that palpation, and considering that I speak quite a bit about multisensory integration, or cross-modal perception, or however you want to term it, we also use vision. So we see and feel things, that comes up. There's also top-down processing, where you're utilizing cognitive thoughts to essentially lead the process. So you're thinking about a theory, and then you go ahead and you palpate. So you've got your theory in your head, and you palpate. So what we're talking about here is the concept of top-down processing, and the capacity for top-down processing to help understand or kind of better identify incongruent stimuli. So the idea of incongruent stimuli is something happens here and something happens over here. So you have a sound over here and haptic feedback or palpatory feedback over here. And what you're trying to do, at least in the research setting, is trying to identify if somebody is able to identify whether it's visual, auditory, or haptic feedback when you make them incongruent. So if I'm trying to ask somebody to identify which side of something or which hand felt the buzz, the physical buzz, the haptic buzz, versus and trying to tell them to ignore the light that flashes. What we have observed, or what the researchers in this case have observed, is that if you give people about 100 milliseconds, they can ignore the distractor. So let's say the light's the distractor. They can ignore the distractor and appropriately identify the target, the appropriate target, which in this case was the haptic feedback. What they're suggesting is that it's top-down processing. So if you give people enough time, they can kind of make up for the deficit in congruence or the deficit in things happening in different locations. Now, clinically, what we want to consider is that if I'm palpating here, okay, if I have my eyes closed, right, what you're going to do is you're just going to push one of your shoulders down. I don't care which one, right, and let it go. Now, if I'm paying quite a bit of attention with my eyes closed, I can feel a small motion. If I want to exaggerate that just so that you can see it visually, right, I'm not going to tell you when. You do it whenever you want. Just push one of your hips down on the table. Right? Now, I felt a movement. Now, based on experience and just hypothesis, I'm going to assume, based on what I felt, that it was probably his left hip. Was it your left hip?
That's correct.
Okay. Now, that is developed over time. I probably wouldn't be accurate with that in any way had I not done things of that nature while combining visual and palpatory feedback in the past. The other reason that I could tell is because as he pushed it down, I didn't feel this light move actively. I didn't feel the muscles tense up, so that's another cue to me. However, if I was trying to combine senses, it might be a little bit more difficult. So what we want to do is just simply understand that top-down processing allows us to make improved congruence. Now, what I was demonstrating wasn't exactly that. What we also want to talk about, though, is, let us just say, again in the example we provided, my eyes are closed, patient's hip moves. I could think, because if I believe that I have extremely well-tuned palpation, that I can feel everything, I can feel this gentleman's essentially cerebrospinous fluid, or his cranial rhythm in his leg. If I believe I can feel his cranial rhythm in his leg, the first thing that we did, when he pushed one of his shoulders down, and there was a very, very small movement in his leg, I could then claim, because I have a theory that I can feel the cranial rhythm, that when he moves his shoulder, or when he shuffles around on the table because nothing's happening and he's getting a little annoyed, that I'm feeling the cranial rhythm. Now the problem here is that top-down processing in that case is evidence of something such as a cognitive bias. So what you see is all there is. So the pieces of information that I've chosen to pay attention to are all there is. There's no other possible explanation. It has to be the cranial rhythm. I could also be talking about theory-induced blindness. So there are people that will essentially say that with inspiration and expiration, all paired structures will internally and externally rotate within the body. What I would say to that is, sure, maybe, don't know. When I look at a patient who takes a deep breath, I recognize that their body moves in relation to the table. So just as a visual for you, I just want you to push this leg down on the table and let go. Now you see how as he pushed his leg into the table, his body moved in relation to it. Push this leg down on the table and let go. And you see another motion. Just, if you pay attention visually, take a very deep breath. Okay, and let it out. Now if you were to see any motion in the legs, which you don't see much, it is entirely likely that it's evidence of his body, his abdomen and his thorax pushing posteriorly against the table. I wouldn't absolutely suggest that what it is proof of the cranial rhythm. It could be, I don't know, or inherent rhythm. I think the more appropriate term many people use is inherent rhythm, or visceral rhythms, or embryological rhythms. All different terms to point to this kind of inherent thing where there's these motions. I think the palpatory sense and the theories that are provided end up creating a very exaggerated explanation. So we started off by talking about the capacity to remove the deficit between incongruent stimuli with multisensory integration. So if you have your eyes open, you see a flash that's on the left, and then something in your hand buzzes on the right. If you're given about 100 milliseconds, you can properly identify the appropriate target that was the buzz. But that's because there's top-down processing. You have enough time to say, where was the buzz, right? In osteopathic manual practice or manual therapeutics of any kind, as we're palpating the patient, if I'm looking straight here, or if I've closed my eyes, the patient can shuffle up here. I can feel some inferred motion, and I can think it was something that it was not, and I can add my top-down processing. I can add my theory to it, but what I'm really doing is assigning a concept to a phenomena that I observed, and those things aren't absolutely related. So you just want to be careful with that.